Hi, my name is Marley Castley, and I'm the Commissioner of Public Health for the City of Quincy. I'm excited to have Deb Toomey join us today for a program called Aging Strong that will be under the Quincy Health Department. It's a pleasure to work with Debbie. We've had many classes in person here at the Kennedy Center, and we plan to transition to Zoom, and we hope that everybody will enjoy this class.
Thank you. Thank you so much, Marley and Quincy Health Department for this new partnership to help me continue to do my outreach work on falls prevention for the aging population. And I've been lucky enough to start offering my in-person programs for the Quincy Health Department for the last few weeks. And the turnout has been really, really good. And I really I'm happy to see that people are wanting to start engaging in the in-person program. So today I was supposed to have a guest speaker, but she was not able to attend. And because I do a lot of presentations on aging strong and fall prevention, I'm more than happy to share the content with you. For those who have seen this before, I've updated the program. And so, you know, I just want you to sit back and relax and just kind of allow the information just to kind of pour over you and participate in the warm-up exercise that I'll be doing with you momentarily, as well as some mindfulness exercises that we'll be doing towards the end of the program. So Marley, I know you need to leave in about 5-10 minutes because you are a busy man. I'm very lucky to have grabbed you to help introduce this new partnership and this new program together.
Very excited for this new partnership with Tufts and yourself and the new programs that we will be bringing to Quincy to help the public and the community in many ways. And, you know, I'm excited to kick those off when we do, and I can't wait to see what the turnout will be. And, you know, I hope everyone will enjoy this class, Aging Strong, on Zoom with Tufts Medical.
Typically, I have different guest speakers who come on and talk about topics that is relevant and really important for the aging adult. And aging adult doesn't have to be 65 and up. It could be 40 and up. Whoever you are and you feel like you need this information that's going to help you live a long and happy and informed life, please continue to watch this program. The Aging Strong program that I created for Tufts Medical Center when I was first hired as an injury prevention coordinator is what I call evidence informed. A lot of programs that's being offered out in senior centers, independent living, assisted living are what's considered evidence-based or evidence-informed. And evidence basically means is there's been research that's been done on the topic or the practices, and those research shows that they work. So because of that, people have developed programs based on these interventions and principles that work, and they put together programs that will really benefit the group that they're trying to serve. And as Tufts Medical Center's part-time injury prevention professional, I focus a lot of my attention on the aging population. And more importantly, teaching them ways how they could become safer, live in a healthy environment, a safe environment, and really teaching them or informing them different topics or ideas that may benefit their lives. So Aging Strong is something I created. It's 4 sessions long. And as Marley and I were talking, I have been offering this in person at the Quincy Health Department. So I'm about to offer the last session in a couple of weeks there, and then switch over to another program called Mindfulness for Healthy Aging. Because mindfulness is very important as well for falls prevention, because when we are mindless or when we're not just being present in the moment, sometimes unintentional injuries can happen. I can give you a story where, I was about to do a program in one of the assisted living independent living community in Milton, Massachusetts. And there's one woman who is just so independent, and she's in her 70s, and she's always out and about doing errands, and she's just such a strong woman. But one particular day, she just had so much to do on her to-do list that she was not paying attention when she was about to cross the street, and she stepped off the sidewalk in a weird way, which twisted her ankle. So she's a very competent, strong, independent, older adult who is so used to moving and going place to place. She wasn't thinking about what she was doing when she was about to step off the curb, and she twisted her ankle. So she couldn't participate in the Aging Strong program, which she was looking forward to, and because she needed to be, she needed surgery, then rehab. So really thinking about being in the present moment, slowing down, paying attention to what you're doing is very important. All right, so let's move on to this program here, the Aging Strong, empowering the aging adults with skills, and that decreases falls and increase independence. Once again, thank you to the Quincy Health Department and QATV for continuing to support this outreach program that I do for Tufts Medical Center. And a disclaimer, whatever you're about to learn is not a substitute for any of your current medical treatments. Always get your doctor's approval. Ask your doctor about exercises, the ones that's really right for you. Always remain informed about your health and medication, and tell your doctors about your concerns, okay? Number 3 and number 4 is really so important just because of my background in nursing. I always try to be an advocate for my patients, and I try to teach them about their medications and what the medications can do for them, and what to be on the lookout for, and when to call the doctor if they're having any type of side effects or concerns about their medication. So really empowering my patients was really big for me as a nurse when I used to do it at the bedside many moons ago. All right, so the basic essence of Aging Strong is keeping active. Keeping active, keep asking questions, and basically keeping it up. Keeping active is so important, and it doesn't really necessarily have to mean that you have to exercise all the time, because some people feel that when they're told you gotta exercise, some people just are not into exercises. But they could be the same people who they may be busy doing their house chores. Maybe they love to garden. Maybe they like to go out for a walk. Maybe they visit friends. Maybe they just like to hike. Those are not necessarily exercises per se, but those are activities that really move the body and enhances not only the physical body, but the mental and emotional health. Keep asking questions. Again, I want people to remember that you are your own, you're the most important person in your life. And when you are there to talk with any type of specialist or doctors, always ask them questions. Don't be shy. Don't be afraid to ask questions, and don't be afraid to speak up for yourself. And basically, keep it up. Just keep up all the good work that you're doing. And I like to start my programs with a warm-up exercise. And whether you are watching in person right now, or perhaps watching the recording of this video, I just invite you to do some activities with me now. Know your body before you start, though. Know your body, know what you can and cannot do. Whatever it is that I'm about to, this is a warm-up exercise. This is a whole list of head-to-toe warm-up exercise that I like to start my programs with, just to kind of wake everybody up and just kind of make people feel like they have already done some sort of an activity for the day. So again, know your body, If you can't do any particular movement, please don't do it. The name of the game is just to warm up the body, just to kind of, loosen up the joints. Okay, so here, sitting up with your head over your heart over your pelvis, away from the back of the chair, and we'll start from the head up. So tilting the chin up just enough so you can see the ceiling. And then slowly tilting it down, looking at the floor. And then again, tilting up, looking up the ceiling. And then down again the floor. And don't forget to breathe. It's important to breathe when you're doing these type of movements. So again, looking up. And looking down, nice and slowly, so you don't get vertigo, you don't get dizzy. There you go. We're just loosening up the neck muscles. So now we're going to look side to side, side to side, like we're looking for the bus or looking for the Uber that we're waiting for. So we're looking side to side, nice and easy. And if you notice that your neck is cracking a little bit, sounding like the Rice Krispie treats, like my neck is doing right now, just nice and easy, slowly. And every time you look side to side, see if you can stretch a little bit more than you did before. Nice and slowly. Very good. All right, so now we're going to do a chin roll. So we're going to start on the right side of the shoulder here, and just we're going to allow the chin to kind of roll across your chest down, and now you're facing the left. And now going the other way, rolling the chin down. There you go. And then again, rolling the chin, going to the left. And again, don't forget to breathe. And then going back to the right. All right, good job. So now we're going to shrug the shoulders. And for those people who have participated in my programs, this part here, shrugging the shoulders, both together up to the ears and then down. Shrugging the shoulders up to the ears and down. Sometimes I call this the I don't know and I don't care move. I don't know and I don't care. Shrugging the shoulders up to the ears and down. So again, shrugging it up to the ears, imagining you get the weight of the world on your shoulders and just let it roll off the shoulders. Just let it roll because you don't need it. Let's do that one more time. Up, 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 shoulders up and down. And now let's roll it forward. Rolling the shoulders, doesn't matter if you're rolling the right first or the left, just rolling it forward. Rolling it, rolling down the river with it. There you go, rolling, rolling. All right, then go the other way. Rolling backwards. And again, just know your body. Some people might have had shoulder surgeries or maybe neck surgery. So just know your body, know what you can do, know the range of motion that you can do comfortably. This is just a warm-up exercise. All right, very good. So now we're going to sit and twist at the waist. So what you're going to do is you're going to take your left hand and you're going to place it on your left knee. And then the right hand is just going to reach behind you in the chair. And you're going to take a deep breath and twist at the waist. So twist at the waist. So you're looking behind you, twisting at the waist. And then just slowly facing the front. And then we're going to do the other side. Right hand on the left knee. Left hand reaching behind. You take a deep breath in and twist at the waist. Twist at the waist. Very good. Nice and slowly moving forward. So those twisting actions are really good because it reminds the muscles that we could still twist. And also whenever you're twisting, especially around the middle area, you're giving the internal organs like the liver, the stomach, the intestine, you're giving them a slight internal massage, which is very good. Now let's do the wrist roll. We're going to roll the wrist going one way. Doesn't matter which way you start. And then go the other way. Very good. And then up and down. For those of you who do a lot of computer work or have carpal tunnel or arthritis, this is good to just loosen up the joints. Open, close, open, close. And then I'd like to add a little bit of a focusing exercise. The thumb touching the pointer finger, thumb touching the middle finger, thumb touching the ring finger, thumb touching the pinky, thumb touching the pinky again, thumb touching the ring finger, thumb touching the middle, thumb touching the pointer. A nice focusing exercise. Helps with coordination and also focusing. And then we'll do a cat-cow. So basically we're going to take a deep breath in. And as we take a deep breath in, we stick out our chest, stick out the chin, breathe in, and then breathe out, going the other way. Breathe in, breathe out. It's good for the spinal column and also good for the lungs. Good for the lungs, good for the spinal columns. All right, so then we're going to reach, stretch, reach, and just stretch up to one side, the other side, the other side, the other side. Good job. Again, we're stretching side to side. And now let's do the stamping of the feet really fast. So if you can, just kind of sit up straight, make sure your feet can touch, and perhaps for like 30, make it 15 seconds. Let's stamp the feet really fast. And the reason for that is it helps with reactivity, because sometimes we could be walking and we trip over something. It's good to be able to have a quick reaction and to be able to catch yourself really fast. And that's why they use this, like stamping the feet really fast. When you watch some of the sports players, that's part of their drills, to be quick on their feet. So we want to be able to continue to remind our muscle, our lower legs, our feet and our ankles, our calves, that it can still catch ourselves in case we kind of, slip or trip. Okay, so stamping the feet for 15 seconds. And I got my watch, so let's start now. Stamp the feet really fast. I don't know if you can hear my feet, my sneakers. 15 seconds. Enough to get the heart pumping, which is good for endurance, good for oxygenation, and stop. All right, so feel free to repeat that again if you want to. And now we're going to reach for the stars. So it's almost like the stretch, but we're going to reach up, reach up, reach up, reach up, reach up, 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 reach, reach, and then forward, reaching forward, and then side to side. And here, if you want to challenge yourself, you could reach up for the stars up really fast. If you can, again, be careful if you've had shoulder surgeries or neck surgeries, just be careful, and then forward fast and side fast. And the reason for that is if we do trip and fall, or try to brace a fall, what we usually do is not only do we try to stop the fall with our feet, but we also try to grab onto something really fast, right? So doing this type of movement, fast movements with our arms, also helps with reactivity time. All right, so we're going to finish up with the ABCs to the toes and the gas pedal. And what we do with that one is, with the ABCs with the toes, you could raise your right foot just slightly off the ground, and you're going to write with your toes a lowercase a, B, C, D, E, F, G. We're going to go through that whole alphabet, and that helps warm up the ankles. It helps warm up the ankles so that when you're walking, you're more agile, and your ankles are more flexible for you. And you know, some people, when they walk, especially as we get older, there's a shuffling that happens. So it's important to loosen up the ankle muscles so that when you're walking, you're more sure-footed. So let's begin with raising the right foot, doing a letter A, small case, lowercase, and then B, and then C, and then D, and then E, and then F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, W, X, Y, and Z. All right, so for those of you who are right-handed, it might be easier for you to write with your right foot. I'm right-handed, so when I work on my left foot, it's a little bit more awkward for me to do the ABCs with my left foot. So, but we're gonna try that. Okay, so raising up the left foot again. So do your best. A, B, doing the alphabet with your left foot. C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, W, X, Y, and Z. All right, almost done. One more, and then we'll move on to the next slide presentation. So the gas pedal is basically you raise up your right foot again, slightly off the ground, and point your toes towards you, and then away from you, towards you, away from you, and this helps warm up the calves and the shin. Okay, so again, these are very important muscle groups that we're working with. We've started from the head, we're going down to the feet now, waking up the body, loosening it up, so when we are more active during the day today, we feel more coordinated, more balanced, more sure-footed, and less likely, hopefully, to have any type of unintentional falls. And then let's do the left foot. Pointing the toes toward you, away, towards you again, away, warming up the left calf muscles, pointing towards you, away, you, away, you, and away, you, and away. Good. All right, so that completes the warm-up section of the program. And again, I love to do this particular warm-up exercise before each of the Aging Strong programs that I do. So here, Aging Strong, strengthening the body and the mind. What is it exactly? Basically, I briefly let you know that it's a fall prevention program that empowers the aging population with tools and ideas that strengthen the body and the mind. This program, once again, encourages the aging adult to keep active, keep asking questions, and just keep up whatever good things you're doing for yourself. It's important to stay active because As we get older, as you all know, our body changes. And with each developmental stage that we reach comes new learnings, new ways of getting to know the body that we have. So it's important to also accept the fact that aging is a part of our growth and development process. And the good news is, people, we are all living longer and longer. And because of that, it's important for us to continue to take care of this body that's going to move us, carry us, take care of us during our later years. Knowing also that lack of activities can lead to injuries because our body we could be deconditioned. Our muscles may shrink a little bit more, which it does. Once we hit the age of about 30 or 40, our muscle mass starts shrinking a little bit, and that is called sarcopenia. And when our muscles shrink in size a little bit, that impacts our strength, our coordination, our balance. So it's important to keep active because that's going to help preserve our muscle integrity. So the Aging Strong program is 4 sessions long. My goal for today is just to introduce to you some of the key concepts from the first and second sessions of the program. But the first session of the program is Stronger Body. Second one is Stronger Mind. Third one is Stronger Person. And the fourth is Stronger Plan. So here I keep talking about fall prevention, but it's important to understand that falls are not really a part of aging. Although the rates of falling increases as we get older, it's not necessarily a part of aging. And we can do something about that. So again, a part of this program will kind of share with you some of the ways that you could reduce your risks for falls. According to the World Health Organization, the common fall-related admissions are traumatic brain injury, so that if you landed on your head, upper limb injuries, that could be frozen, it could be broken wrist, depending on how you catch yourself, broken shoulder, maybe if you fell on your shoulder, or hip fractures, maybe if you fell on your hip. So once again, falls are preventable. So the best way to prevent falls are to eliminate factors that leads to falling, becoming more active, using assistive device when needed. So if you have been instructed to use assistive devices, remember to use them. Don't walk away from them. Or if you're finding that, you know what, you're moving around, but you seem to be holding on to a lot of furnitures and you're losing your balance, perhaps that might be a time for you to let your doctor know that you might need a physical therapy consult so that they could do exercises with you and perhaps give you or teach you certain assistive devices. It could be a cane, it could be a walker, that could be beneficial for you to help you be able to move around more and independently. Another risk factor is making sure that you're getting routine checkups from your doctor. Don't skip any of your routine checkups because that's your doctor's way of making sure that you're doing okay, answering any questions that you may have, especially during the time that we're living in this pandemic. Things are just so uncertain. And whenever you can get a doctor's appointment, try to keep that appointment. If you cannot make that appointment, see if that can be a telehealth appointment. Don't let the fact that you can't get there because of a ride cancel your appointment because it's really, depending on who you see, it could be hard to book an appointment right away with your doctors because the doctors are so busy, or nurse practitioners or physician assistants. They're so busy that their schedules fill up really quickly. So if a ride to your appointment is going to be an issue, let the doctor's office know that and see if you could at least switch that particular appointment to a telehealth. And if they can accommodate, good. So at least you know that you're able to meet with a doctor and your doctor is able to meet you in a timely fashion. Another way to reduce falls is reducing your stress. If you can reduce stress somehow, depending on, everybody has their own way of reducing their stress. Somebody their stress could be reduced from going for walks. Somebody's stress could be reduced from listening to music. Somebody's stress could be reduced from talking with family. So just knowing different things that you could do, activities that you could do to help reduce your stress is very important, especially around these times. The more you know, or the more you have many things that you can have to choose from to reduce your stress also is going to be beneficial. Because one thing, maybe hiking may not be something that you feel like doing one day because it could be stormy outside, but you might have other activities that could really help reduce your stress. It could be, doing some yoga, putting on YouTube and maybe watching some yoga, or maybe watching a movie, or, talking with a friend. So again, knowing activities that help reduce your stress, that fills your spirit, is very important. Knowing your medication is also another important thing, because there are medications out there that can make us unsteady on our feet. It can make us tired. It can make us sleepy. And if you take other medications on top of that, that can maybe potentiate the effect of that medication, make you more sleepy or more tired, that can lead you to a higher fall risk. So knowing these medications, your medications, what they do is very important. There's such a thing called polypharmacy. I had Dr. Donna Barrett on a few months ago, and she talked about polypharmacy and how, some people have 5 or more medications, and how it's important for us to know what our medications are. And during the program, she talked about, deprescribing also. She said that if people are on medications for many, many, many years, like 20 or 30 years, asking your doctor if you continue to need some of those medications is very reasonable, because your body 20 or 30 years ago is different from your body now. And maybe your height and weight could be different compared to, what you're presenting it with right now. As we get older, sometimes we kind of, our height goes down a little bit, and maybe you have gained a lot of weight, or maybe you've lost a lot of weight. So, some of these medications that you may have been taking for many years may not work as well for you. So asking your doctor if you still need them, or maybe decreasing the dose, is important, okay? And that's within your rights. Always ask questions about your health and your medications. So home fall hazards. There's a lot of words here. So basically it says 4 things you can do to prevent falls. And this is from the CDC, the Center for Disease Control and Prevention. Exercise to improve your balance and strength. Have your healthcare provider review your medications with you. Have your visions checked. Make your home safer. Remove things that you can trip over, like papers, books, clothes, shoes, from stairs and places. The other day, I was combing my hair, and I added a special conditioner for my hair, and it was a spray. And I didn't know that the spray had landed on my bathroom floor. And the next day, I was walking around with my slippers, and there was a particular area on my bathroom floor that was a little bit more slippery than the others. And I thought about it, and it occurred to me that when I was spraying my hair with a special conditioner, some of that conditioner made that part of the floor very slippery. So I had to really scrub that area just to kind of get that material off, some of that conditioning material liquid that had dried on my floor. So, your floor could be nice and clean, but just being careful if you're spraying something that can cause the floor to be more slippery than the other spots, just be mindful of that. All right, so again, removing things that you could trip over, books, clothes, paper, shoes. Don't put anything on the stairs or places you could walk. Throw away small rugs that you could trip over. If you want to keep it, try to use a double-sided tape to keep the rugs in place, especially the corners. You know how the corners can kind of curl up a little bit. Remove small throw rugs and use double-sided paint. Okay, we did that. Keep items you use often in the cabinets. Keep them up and away from children. Making sure you have grab bars. Okay, use non-slip mats in the bathtub or on the shower floors. Improve the lighting in your home. As we get older, we need brighter lights to see better. Having and using handrails when needed, and make sure it's well lit, and wear shoes. It's always good to wear shoes, not necessarily flip-flops, because footwear makes a big important, it's important for us to have proper footwear, so that when we do walk around, once again, we feel more sure-footed and nothing can like fall off our feet when we're walking. All right, so here some risk factors for falling. These are medical conditions and medications. There's a whole list, but here are just some of them. If you're diabetic, if you have depression, if you have syncope, if you have cognitive impairment, vision, hearing problems, incontinence, alcohol, street drugs, history of falls. If you have a history of falling, you're twice as likely to fall again. So just being careful of that. Medications that can cause people to fall, some blood pressure medications, antidepressant medications, diuretic. If you take medications that impact or help with your heart rhythm, diabetic medications, and sleeping medications. All right, so here, physical activities. It's physical exercises, I should say. It's important to have exercises that can help with balance, stretching, endurance, and strength. And a recommendation from the CDC is knowing what you normally do. What is checking in with yourself, knowing what your normal activity level is. And what they're recommending is, on top of that, if you can, adding 2.5 hours more of moderate to intense aerobic activity a week. And also, remember I talked about how our muscles decreases in size as we get older. It's important to also do muscle strengthening activities 2 or more times a week. So that way we're strengthening our major muscle groups. And, you know, I know that's what the CDC had recommended, to add more activity, but really also know what's realistic for you. If you are the type of person who hasn't really been going outside, maybe a reasonable activity for you to start with, now that the weather's getting nicer, is to go outside and sit with friends. And perhaps you are the type of person who's already doing that. You're outside, you're socializing with friends, maybe kicking it up a notch and maybe going for a stroll. Okay. Or if you're the type of person who already likes to walk, perhaps adding dance, any type of activities that can really help you get into your physical activities is really going to be important. Exercises, activities, very good for us. If it helps, turn on some music, do it with other people, just so it'll be more fun for you. All right, so here's the schedule that I like to hand out to people who are in my program. It breaks down the 2.5 hours of activities that the CDC recommended, just to make it look more reasonable. So perhaps walking 15 minutes extra on one day, and maybe doing some balancing exercise for 15 minutes on the other days. And then maybe ending it off with some quiet activity like a meditation, a prayer, or journaling. And then the next day, continuing to do a little bit of walking, but maybe focusing, instead of balancing exercise, maybe a strengthening exercise. And then the next day, flexible exercises. So you don't have to do everything in one day. You could break it down in chunks of 15 minutes or 10 or 5 minutes, just as long as you're keeping active, doing something a little bit more than what you would normally do. That's the name of the game, is just to keep active, Keep asking questions and just keeping it up. All right, so real quickly, the second session of the Aging Strong talks about the brain and the mind. And, you know, as we're getting older, you know, sometimes we kind of, you know, do one of these head scratching type looks where you kind of walk into a room and you feel like, okay, what did I come in here for? Or, you know, you could be talking to somebody in the middle of a conversation and you say, oh, what was I saying? I don't know if that's ever happened to anybody, but that certainly has happened to me. So, you know, sometimes it could be just because of age, or it could be because we're not really, we have too many things going on in our mind. We're not paying attention. So this particular segment really helps people focus in on, you know, the importance of brain exercises, which, by the way, is basically the same type of exercises you would do for a total body exercise, like moving or walking or dancing or swimming. Anytime you're engaging the whole physical body, guess what? We are also engaging the brain muscles, which is great. So, you know, here are some 5 brain exercise or 5 brain facts. Number 1 is brain weighs 3 pounds. It's 70% made of water and 60% made of fat. It uses 20% of our total body oxygen, and brain exercises help delay memory loss and dementia. Okay, so the Mayo Clinic states that physical activities lessens depression and anxiety. It helps release endorphins, which is our feel-good hormones. It takes our mind off the worries. It helps us gain confidence, helps us become more social, and also helps us with coping. All right, so neurobic trains the brain to function fully. So anytime we are exercising our whole mind or body, we are exercising the brain. It helps with awareness, helps with concentration, coordination, memory, and relaxation. So what I want to do is switch over to a mindfulness activity, which will be very helpful because we have 10 more minutes left of the program, and I really want to be able to share with you some mindfulness practices that you could start using right away. And for those of you who are not really too sure of what mindfulness is, what it is and how to do it, basically mindfulness is a practice that you do purposefully so that you're in the present moment. You're using as many of your senses as you can as possible so that you are just there in the moment. You're not thinking about what just happened yesterday, or you're not thinking about your worries. You're not thinking about what's going to happen later on. It's just you being fully there in the present moment. So that's basically mindfulness. And any activity that you could do to kind of help you stay in the present moment is very rejuvenating. It's very relaxing and very healing for your mind and body. It helps decrease the stress, this reactivity to stress. So what I'd like to do is I'm going to advance the slide real quickly because I want to show you. Okay, so different types of mental exercises or meditation exercises. It could be praying, it could be meditating, it could be practicing, noticing your breath. It could be journaling, it could be drawing, it could be gardening. Any activities that makes you really feel like you're in the present moment. It could also be doing the crossword puzzle if you love to do it. So again, any type of activities that can have you focus on what it is you're doing is in a way mindfulness in action practice. So what I'd like to do is teach you a breathing exercise called the 2-to-1 breathing exercise where you breathe in through your nose for the count of 3. We'll pick the number 3. You breathe in for 3, you hold your breath for 3, and you breathe out through your mouth slowly for the count of 6. So let's do a few rounds of that, because as we take slow, purposeful, mindful, deep breaths, it helps engage the relaxation response in our body. And one of the best and the quickest ways to quiet or soothe an overwhelmed, a frustrated, a stressed mind is through the breath. So remember, in one of the brain facts that, we use a lot of our, about 20% of our oxygen that we take into our body goes to our brain. So with that in mind, let's take some nice, slow, deep breaths called 2-to-1 breathing exercise. So breathing in slowly through your nose for the count of 3. I'll count for you. 1, 2, 3. Holding the breath for 3. 1, 2, 3. And then breathing out for 6. 1, 2, 3, 4, 5, 6. Okay, let's do that again. Let's do a few more rounds of that. And just notice how your body is feeling as you're taking these nice slow breaths. So breathing in for 3 through your nose. 1, 2, 3. Hold your breath. 1, 2, 3. Breathe out for 6. 1, 2, 3, 4, 5, 6. Catch your breath. And let's do that 2 more times. Breathe in for 3. 1, 2, 3. Hold. 1, 2, 3. And breathe out for 6. 1, 2, 3, 4, 5, 6. Let's do one more. Breathing in for 3. 1, 2, 3. Hold. 1, 2, 3. Out for 6. 1, 2, 3, 4, 5, 6. So that's called 2-to-1 breathing exercise. It's one of my favorite breathing exercises. And it's something that sometimes I catch myself doing. If I'm running late, I'm stuck in traffic and I'm worried about, not making it there on time. And, I'm worried about how long the traffic is going to take. I just tell myself, okay, let's breathe. So I breathe in. I don't even have to close my eyes. I'm driving and I just kind of breathe in for 3 and I hold my breath for 3, breathe out through my mouth, out for 6. And I just keep repeating that and repeating that and repeating that. I notice that when I do it, it calms me down. It calms me down and it doesn't make me feel as stressed. So, as we all know, the world that we're living in right now has so many different things that's coming at us from different angles. Not only, the pandemic and, the situation out in Europe and just different things that, that life delivers to us. The more we're able to self-regulate and find ways to self-soothe ourselves in a healthy way is so, so important. And one of the best ways to do that is through our breath. All right, so let me just introduce to you, we have a few more minutes. I want to share with you a body scan exercise. And that is another meditation, or like a mindfulness meditation. It's something that I used to do for the staff at Tufts Medical Center before COVID hit. I would do a mindful Monday exercise during lunch breaks. And I would invite, available staff who can get out for maybe 15, 20 minutes to join me. And a few times the CEO of the hospital would join me. And that was really impressive because that shows that, top leadership believes in the power of meditation and that he himself needs a certain break to help him lead the hospital organization in the best way possible. So let's take maybe a few minutes of this body scan meditation. So you could sit up straight, head over your heart, heart over your pelvis. And if you want to close your eyes so you could be more in tune with your breath and also the sound of my voice. And we'll just do this for a few minutes. So closing your eyes nice and slowly if you feel comfortable doing so. Breathing in through your nose, nice and slowly. Breathing out through your mouth, nice and slowly. And then again, noticing as you're breathing in through your nose, maybe the coolness of the breath as it goes into your nose. And then out through your mouth, perhaps noticing the warmth of the breath as it leaves your mouth. Again, breathing in through the nose, nice and slowly, noticing the cool breath. And out through the mouth. Now bringing your attention, the awareness to the very top of your head. Just noticing the top of your head, how it feels. We're not touching the top of the head. We're just mentally bringing awareness to that part of the body. And then bringing the awareness down to your neck and shoulders, to your hands, to your chest, noticing the rise and fall of each of your chest with the breath that you take. Bringing awareness to your belly, noticing how your belly goes up and down with each breath that you take. And then bringing awareness to your legs, both legs. Moving down to your feet, noticing your feet. And then bringing awareness to your whole body, noticing your whole body all at once. Bringing awareness to your whole body all at once. And then going back to the face, noticing your eyebrows, your cheeks, your chin, the tip of your nose, and then bringing awareness to your breath, noticing that breath as it goes in through your nose and out through your mouth. In through your nose and out through your mouth. In through your nose and out through your mouth. And then if you had your eyes closed, slowly open your eyes. Wiggling your toes and your fingers, coming back, waking up. We're feeling more refreshed and awake and alert. So checking in with yourself. Notice how you feel after this body scan meditation. This is a good meditation to do if you can't fall asleep and you need to relax. Scanning, you don't have to start from the head. You could start from the feet and just working yourself up. A great meditation to do. All right, so we will wrap it up there. I have so much more to share with you, but I just want to make sure that I honor your time. And before I do close and this program, I'm going to stop the share. Let me just see here. Yeah, I want to give you my contact information. If you have any questions for me, or if you think your local senior center might be interested in having me do the full program, either virtually or in person, depending on the location. My contact information for work is dtoomey@tuftsmedicalcenter.org. And I'm going to stop screen share here right now. All right, so before we end, I want to once again thank the Quincy Health Department for this new partnership. I look forward to doing more programs and inviting more guest speakers. Thank you so much. Have a great day. And remember to keep on aging strongly. Take care. Bye-bye.